A study came out this week linking estrogen use after menopause to an increased risk of dying from ovarian cancer. So how concerned should women be about this research? We have with us Dr. Loret de Mola. He is University Hospital's Chief of Reproductive Endocrinology and also Infertility. Thanks for being here with us.
My pleasure. Thanks for inviting me.
So can you give us just some idea of what this study was really looking for?
Well, this study was a very large study, the largest done to date, that looked about 500,000 women, and this was organized by the American Cancer Society, and they sent questionnaires to women, and they asked them a variety of questions, among them the use of estrogen for the menopause.
Right.
And they basically review all this information and found that there was an association between the use of estrogen and ovarian cancer.
So how concerned should women be who are taking estrogen, and are there some limitations to this study?
There are many limitations to the study, and I think that the study simply tells us that we have to look at this with more caution. This link has never been made before, and therefore we should do further studies to investigate it. I think that women that have been taking estrogen for greater than 10 years, the study showed that there was a doubling in the risk of ovarian cancer, and I think that women that have been on estrogen for more than 10 years should consider talking to their doctor and review their current use of estrogen.
But the incidence of ovarian cancer is still a fairly small percentage, is that right?
That's correct, and that's why one must be very careful looking at the study. The current risk of ovarian cancer in women is about 1%. The study, after 10 years of use, increased it to about 2%. It's still significant, but when you look at the whole picture and all the benefits that women get from estrogen, it's a very, very small risk.
What are some of the benefits? I've heard quality of life.
Definitely. The first thing that brings women to the doctor during the menopause is the symptoms associated with the menopause. Hot flushes, dryness, not sleeping at night, waking up in the middle of the night, and all those short-term symptoms get significantly reduced with estrogen therapy. So it's really beneficial.
And there are a lot of women who have gone through menopause that are on estrogen, right?
That's correct. And I would say that about 2/3 of women that go into menopause start estrogen at least for a short period of time to relieve some of the symptoms.
A lot of times when these studies come out, people get very alarmed. What would your advice be at this point for women?
I think that women should not be alarmed at this point in time. This study had a lot of handicaps. It was retrospective in a sense that women were being asked to fill a questionnaire and remember how much estrogen or what they were taking. There were a lot of smokers also in that group, and the women that were not taking estrogen were older than the women who were taking estrogen.
Okay, so take all that into consideration.
That's right.
Thank you so much for being here.
Thank you.
All right, and now we're going to head out to Eileen McShay, and she